So what antibody-drug conjugates we have in lung cancer? Currently, there is only one antibody-drug conjugate which is approved. This is for patients with stage 4 lung cancer and a mutation in a gene called HER2, HER2 exon 20 insertions. There are other antibodies in development. I think the ones that, in my opinion, is a little bit further along and have a really good efficacy data, does not yet have an FDA approval, is patritumab deruxtecan. It's an antibody against HER3, and it's currently being developed in EGFR mutated secondary resistant non-small cell lung cancer. We have an antibody against TROP2. There are two companies having an antibody against TROP2, and they are being developed in newly diagnosed stage 4, treatment naive, as well as previously treated. Then we have a MET antibody-drug conjugate. It has a complicated name, but we call it Teliso-V, and it's currently being developed in patients with EGFR mutations who develop secondary resistance through the pathway called MET. And then there is a CCOM monoclonal antibody. We don't know yet where that is going to fall because there are some negative studies, so I'm not sure the company where they're going to develop that antibody further. That's why I put a question mark. So this is the only antibody-drug conjugate that's currently approved. This is what we call the waterfall plot. I'm the first one showing the waterfall plot, so I'll explain you what that is. The reason why it's called the waterfall plot, because it looks like a waterfall. Every single bar represents a patient. So at time 0, we all start at time 0. And as your cancer shrinks with treatment, that is the bar goes down. And the height of the bar depending on what's the percentage of cancer shrinking. And then we just kind of rank them in the order. So you can see on the very right side of that waterfall plot, there is a patient who had 100% decrease of the tumor, meaning all the cancer cell went away on the imaging. And then on the left side of the slide, you see the patient where the bar is going above 0, going up. That means that the patient cancer unfortunately grew on this therapy. So overall, there is almost 55% of the patients who responded on this therapy. The median time before the treatment stopped working was 8.2 months, and the median survival on this clinical trial was almost 18 months.